Millions of people in Germany take their blood pressure medication every morning and assume they are doing everything right. This is exactly what makes this topic so dangerous. Medications like Amlodipine, Ramipril, Candesartan, or Bisoprolol are among the most commonly prescribed drugs in the country. They are taken daily by millions of seniors. Nevertheless, many affected individuals know surprisingly little about what these substances actually change in heart blood vessels and kidneys. Most rely on a brief explanation from the doctor or the package insert. However, this is often where the information that can determine safety and risk in everyday life is lacking. A seemingly harmless infection, a hot summer day, too little fluid, an extra tablet. Under the wrong circumstances, such situations can suddenly trigger consequences that many patients would never associate with their blood pressure medication. I am Dr. Thomas Weber. For over 30 years, I have been working with older patients and have repeatedly witnessed how cautious, well-informed people fall into avoidable medical traps simply because no one has explained certain connections to them. In this video, you will learn how the 4 most common blood pressure medications really work, which warning signs you should never ignore, and which mistakes frequently lead to problems. Before we begin, please briefly write in the comments which blood pressure medication you are currently taking, and if understandable health information is important to you, subscribe to the channel. Let's get started. The pillars of therapy and the case study of Jürgen. First, let's look at Jürgen's situation to understand how quickly a misunderstanding can arise. Jürgen is 47 years old and a former mechanical engineer from Dortmund. He is a very conscientious, rational, a thinking man takes his medications according to a strict schedule organized by his daughter. When a general practitioner prescribed him Amlodipin due to changed values, Jürgen thought nothing of it. He believed that all blood pressure tablets were basically the same and interchangeable. However, 3 months later, his legs felt leaden from 4 p.m. onwards. His ankles were so swollen that he could no longer fit into his beloved leather shoes. Jürgen became very scared, panicked, and searched the internet for the symptoms of heart failure. But the truth was not an incurable, serious illness, but a pure misunderstanding of the pharmacological substances. In Germany, doctors today primarily prescribe 4 major groups of blood pressure medications. First, calcium channel blockers like Amlodipin. Second, ACE inhibitors like Ramipril. Third, sartans like Candesartan. And fourth, beta blockers like Bisoprolol. Each of these groups lowers the pressure in the vascular system reliably, but each does this in a completely different biological way. When you understand the principle behind their daily pill, you lose the fear of harmless side effects and immediately recognize real life-threatening warning signals. First, Amlodipine and the trap of swollen ankles. Amlodipine is an extremely effective medication for relaxing the smooth muscle in the arterial bends. It widens the vessels so that blood can flow from the heart through the body with significantly less resistance. But this is precisely where a purely mechanical problem lies that causes many seniors to despair in everyday life. Amlodipine effectively relaxes the small arteries that direct blood to the legs. However, the veins responsible for returning blood upward to the heart do not relax to the same extent. This creates a hydraulic imbalance in the tissue. It flows significantly more blood into the lower extremities than can be simultaneously transported away by the veins. The consequence is the so-called amlodipine edema. Due to the increased pressure in the capillaries, fluid is pressed directly into the surrounding tissue of the ankles and feet. In most cases, this is not a sign of acute kidney failure and also not evidence of an emerging heart condition. It is a direct, physical-logical consequence of the active ingredient on the vascular architecture. Many patients now make the fatal mistake out of fear of swelling and drink less water, because they believe their body would retain water. Please never do that. Dehydration while taking calcium channel blockers puts a massive strain on your circulation. Instead, talk to your treating physician about a cautious adjustment of the dosage or about moving the intake to the evening to reduce the hydrostatic pressure during the minimizing days. Do you often have deep, painful imprints from your socks on your skin in the evening after taking them off? Or do your feet feel heavy? Please write yes or no briefly in the comments. This honest observation is the first step to finding the best routine for your lasting mobility together. Secondly, Ramipril and the persistent dry cough. Let's move on to the second major group, the ACE hammer. The medication Ramipril is the absolute leader in medical prescriptions in Germany. It not only protects your heart after a heart attack, but is also the gold standard for long-term protection of your kidneys in the case of existing diabetes. However, Ramipril has a very specific biochemical side effect that torments many people for months: a dry, completely unproductive, and tickling cough in the throat area. This cough arises from the blockage of a specific enzyme, this leads to the accumulation of a body's own messenger substance called bradykinin in the mucous membranes of the airways, triggering a permanent cough reflex there. Let's take the example of Renate. Renate is 71 years old and lives in Spreewald. She loves her garden and understandably thought her cough was due to pollen or too dry air in the house. She bought expensive cough syrup from the pharmacy for months without feeling any improvement. It was only when we reviewed her standardized medication plan during my consultation that the cause became immediately clear. Renate had been taking Ramipril for 11 months, but the cough first appeared in the 4th month of treatment. This is the Turkish time trap of ACE inhibitors. The side effect does not have to show immediately in the first week, but can develop gradually after many months. If you suffer from this specific irritant cough, there is a safe, medical solution: a clears throat coordinated switch to a medication from the group of sartans, such as Candesartan, usually resolves the problem completely within just 7 days through a different mechanism of action. Thirdly, the life-threatening warning signal, angioedema. While the dry cough associated with taking Ramipril is merely annoying and reduces quality of life, there is an extremely rare but absolutely life-threatening signal in this group of medications where you must not hesitate for a single second. In isolated cases, ACE inhibitors can trigger a so-called angioedema. This results in a sudden massive accumulation of fluid, causing your lips, tongue, face, or even the entire throat area to swell dramatically. If you ever notice that swallowing suddenly becomes difficult while taking Ramipril, your airways feel constricted, or your voice changes hoarsely for no reason, you must not, letting minutes pass unused. In this case, do not take a simple antihistamine under any circumstances, and do not hope for an overnight improvement in bed. Call the emergency services immediately and without delay at the emergency number 112. This is an acute medical emergency, as angioedema can completely block your airways in a very short time. Burn this difference into your memory forever. A dry cough is an inconvenience, but a swollen tongue means acute life danger. Fourth, Candesartan and the hidden potassium trap. The third major group of modern blood pressure medications are the sartans, with their main representative being Candesartan. These medications are considered particularly well tolerated in modern geriatrics and have a significantly lower rate of side effects than the older ACE inhibitors. Nevertheless, there is a hidden risk for health-conscious seniors in Germany has a significant invisible danger in daily nutrition when taking Candesartan. The active ingredient ensures that the vital mineral potassium is retained in the blood by the kidneys. Many older people in Germany rightly try to avoid table salt or sodium to protect their blood pressure. Therefore, they buy so-called diet salt, blood pressure salt, or potassium-rich substitute salt in health food stores, pharmacies, or supermarkets. These products replace harmful sodium with potassium chloride. If you are now taking Candesartan and at the same time generously seasoning your food with this potassium-based salt substitute, the potassium level in your blood rises unnoticed to a highly dangerous level. Such hyperkalemia does not cause any pain in the initial stage, but it dramatically disrupts the sensitive electrical conduction of your heart muscle. The clinical symptoms manifest gradually as unusual muscle weakness in the legs, a fuzzy tingling in the hands, or a sudden irregular heartbeat. Therefore, be sure to check the labels of your food in the supermarket and consistently avoid artificial salt substitutes. If a satan is on your medication plan, use fresh herbs for refinement instead. Fifth, Bisoprolol and the limit of their load capacity. The fourth essential pillar of blood pressure therapy in Germany is beta blockers, such as the widely used active ingredient Bisoprolol. These medications work directly on the heart by specifically slowing down the heart rate and the ejection force. They protect a pre-damaged heart from dangerous overload and stress hormones. However, in advanced age, this therapeutic break can sometimes be too strong under certain circumstances. If your pulse drops permanently below 50 beats per minute at rest due to taking Bisoprolol, if you feel chronically tired, listless, and as if wrapped in cotton in everyday life, many seniors then complain about sudden shortness of breath while climbing stairs in the morning and mistakenly believe they are simply old or out of shape. In reality, the heart may not be able to increase the pulse quickly enough to meet the increased oxygen demand of the muscles due to the blockade of the beta blocker during physical exertion. If you observe this persistent exhaustion in yourself, you should regularly measure your pulse in the morning and evening, document the values precisely, and actively address this phenomenon at your next appointment in the practice to possibly adjust the dosage. Has your treating physician ever explained to you in detail how to manage your blood pressure medications when you are dehydrated due to an acute infection? Just write yes or no in the comments. Unfortunately, it is frightening how often this occurs in clinical practice. Vital signs and can lead to severe complications. It is crucial to adjust medication dosages in such situations to prevent harm. Kidney filters as intended. Therefore, be sure to ask your family doctor for a written individual sick day plan. This will medically specify which specific tablets you need to pause for 1 to 2 days in case of severe fluid loss to protect your organs. Another extremely underestimated danger to your health is the so-called triple whammy. In German, the triple blow against the kidney. This refers to the highly dangerous combination of 3 active ingredients: your regular blood pressure medication, Ramipril or Candesartan, an additional water tablet for dehydration, a diuretic, and a completely ordinary painkiller like ibuprofen or Voltaren, which can be purchased over the counter at the pharmacy. These 3 substances together massively interrupt blood circulation and hydraulic filter pressure in the kidney glomeruli, so much so that kidney function can completely collapse within a few days. If you suffer from joint pain, consult with your doctor and prefer safe alternatives like paracetamol. To ensure your autonomy and quality of life, let's briefly and precisely summarize the vital knowledge from our video today for your daily life. Your daily blood pressure tablets are highly modern and powerful tools of medicine to effectively prevent strokes and heart attacks. But as a patient, you must know the exact operating instructions of your body. Snorts. Amlodipine often causes physically induced but essentially harmless swelling in the ankles. Ramipril can trigger a chronic neurogenic cough but requires an immediate emergency call if there is swelling in the face. Consistently watch out for the invisible potassium trap when taking Candesartan and regularly check your resting pulse when undergoing treatment with Bisoprolol to avoid an overdose. To the informed expert for your own federal uniform medication plan. Actively take this knowledge with you to your next doctor's appointment and ask targeted questions about interactions and your personal behavior with infections. A well-informed patient is the best protection against avoidable mistakes. In the healthcare system, you protect your blood vessels, your heart health, and your kidney function through attention and the right safe routine in the morning. If this deep, understandable insight into the mechanisms of your daily medication has helped you today and given you more security, please show me now with a thumbs up right under this video. Subscribe to this channel, Dr. Thomas Weber, and make sure to activate the bell so you don't miss any of my important advice for a healthy, self-determined life from the age of 60 in the future. Share this video now directly via WhatsApp with your friends, from your senior group, your neighbors, or your relatives. A timely warning about interactions can save a good friend from acute kidney failure this summer. However, the correct adjustment of their medications is just one pillar for a long life. There is a very specific fruit that is regularly found on almost every German's breakfast table or consumed as juice, which can completely block the effect of their tablets or dangerously enhance it. In my next video, I will reveal this invisible enemy from the kitchen. Stay critical, pay attention to your health, and above all, stay steadfast. This video is intended solely for general information, health education, and preventive advice for interested viewers. A professional medical consultation can and should provide an exact clinical examination or an individual medical diagnosis by and never replace a qualified specialist doctor in case of illness. M.